Welcome, medical students. In today's video, we will explore respiratory disorders, covering their causes, symptoms, diagnosis, and treatment. We will discuss various conditions, such as respiratory distress syndrome, chronic obstructive pulmonary disease, asthma, and lung cancer. Get ready to become well-versed in the semiotics of these respiratory conditions. Let's begin. Respiratory distress syndrome, RDS, also known as hyaline membrane disease, primarily affects premature infants. The pathophysiology of RDS involves a deficiency of pulmonary surfactant, leading to alveolar collapse and impaired gas exchange. Clinical manifestations include tachypnea, expiratory grunting, nasal flaring, and retractions. Chest X-rays reveal bilateral diffuse infiltrates with a ground glass appearance. To manage RDS, immediate interventions such as exogenous surfactant administration, ventilatory support, and oxygen therapy are crucial. Chronic obstructive pulmonary disease, COPD, is a progressive respiratory disorder primarily caused by tobacco smoke exposure and characterized by airflow limitation. The diagnosis of COPD entails assessing symptoms, including chronic cough, dyspnea, and sputum production, spirometry to measure forced expiratory volume in 1 second, FEV1, and determining the FEV1/forced vital capacity, FVC, ratio. Management of COPD involves smoking cessation, pharmacotherapy, for example, bronchodilators, corticosteroids, oxygen therapy, and pulmonary rehabilitation programs. Asthma is a chronic inflammatory disorder of the airways with recurrent episodes of wheezing, breathlessness, chest tightness, and coughing, often triggered by allergens or irritants. The underlying pathogenesis involves airway inflammation, bronchial hyperresponsiveness, and airway remodeling. Management of asthma includes education on triggering factors, medications, such as short-acting beta agonists, inhaled corticosteroids, leukotriene modifiers, and personalized action plans to guide self-management and prevent exacerbations. Pulmonary embolism, PE, occurs when a blood clot travels to the pulmonary circulation, obstructing blood flow. Symptoms of PE vary but commonly include sudden onset dyspnea, pleuritic chest pain, and hemoptysis. Diagnostic evaluation involves a combination of clinical probability assessment, D-dimer testing, and imaging modalities such as computed tomography, pulmonary angiography, CTPA, or ventilation/perfusion, VQ, scanning. Management encompasses anticoagulation therapy, thrombolysis, and occasionally embolectomy in severe cases. Pneumonia is an infection affecting the lungs that can be caused by bacteria, viruses, fungi, or aspiration. Clinical features include fever, cough with sputum production, pleuritic chest pain, and breathlessness. Diagnostic evaluation involves a combination of clinical assessment, chest radiography, and microbiological tests, for example, sputum culture, blood culture. The choice of antimicrobial treatment is guided by the suspected etiology, severity of illness, and local resistance patterns. Pleural effusion refers to the accumulation of fluid in the pleural space. It can result from various etiologies, including infection, malignancy, and congestive heart failure. Clinical evaluation involves a detailed history, physical examination, and imaging studies such as chest X-ray and ultrasound. Diagnostic thoracentesis with fluid analysis helps determine the etiology and guide treatment strategies, including thoracentesis for symptom relief, pleural drainage, or pleurodesis. TB is an infection caused by Mycobacterium tuberculosis that mainly affects the lungs. Diagnosis involves clinical assessment, tests like TST/AGRAS, chest X-ray, AFB smear/culture, and PCR. Treatment includes multiple drugs, and preventive measures against spreading. In this video, we will be discussing interstitial lung diseases, ILDs, which are a collection of conditions that cause inflammation and fibrosis in the lungs. Diagnosis involves a careful clinical examination, advanced imaging techniques, lung function tests, and in some cases, a lung biopsy. Treatment options vary depending on the subtype of ILD and can include medications to suppress the immune system, supportive therapies, and, in severe cases, lung transplantation. Lung cancer, a serious form of cancer linked to smoking, presents with symptoms like cough, coughing up blood, weight loss, chest pain, and difficulty breathing. Diagnosis involves imaging tests and tissue sampling, while treatment may involve surgery, chemotherapy, radiation therapy, targeted therapies, and immunotherapy. Pulmonary hypertension, PH, is a progressive disorder characterized by elevated pulmonary artery pressures, leading to right heart dysfunction. Diagnosis involves a comprehensive evaluation, including echocardiography, right heart catheterization, lung function tests, imaging studies, CT scan, ventilation/perfusion, VQ scan, and serologic testing. Management includes addressing the underlying cause, pulmonary vasodilator therapy, diuretics, anticoagulation, and, in severe cases, lung transplantation. Obstructive sleep apnea, OSA, is a common sleep disorder characterized by recurrent episodes of upper airway collapse during sleep, leading to oxygen desaturation and fragmented sleep. Clinical features include loud snoring, witnessed apneas, daytime sleepiness, and morning headaches. Polysomnography, overnight sleep study, is the gold standard diagnostic test. Management strategies involve lifestyle modifications, continuous positive airway pressure, CPAP, oral appliances, and surgical interventions. Cystic fibrosis, CF, is a genetic disorder affecting multiple organ systems, primarily the lungs and digestive system. Clinical manifestations include chronic respiratory infections, pancreatic insufficiency, malabsorption, and infertility. Diagnostic evaluation involves a combination of sweat chloride testing, genetic testing, identifying CFTR mutations, lung function tests, and imaging studies. Management encompasses a multidisciplinary approach, including airway clearance techniques, enzyme replacement therapy, nutritional support, and targeted therapies. In conclusion, respiratory disorders involve various conditions with intricate diagnostic and treatment complexities. Understanding their underlying mechanisms, clinical presentations, and semiotics is essential for accurate diagnosis and effective patient care. By exploring the topics discussed in this lecture, you have gained valuable insights into respiratory distress syndrome, chronic obstructive pulmonary disease, asthma, pulmonary embolism, pneumonia, pleural effusion, tuberculosis, interstitial lung diseases, lung cancer, pulmonary hypertension, obstructive sleep apnea, and cystic fibrosis. Keep expanding your knowledge in this field, as it significantly contributes to improved patient outcomes and optimal respiratory health. Thank you for your attention, and best wishes in your medical studies.